This is a normal left visual field. It certainly looks normal. The blind spot is where it should be. It's not too big. The rest of the plot is fairly light grey. We see that the patient has no fixation losses, very few false positive errors, so they're not very trigger happy, very few false negative errors, only 3%, and did the test in a pretty speedy time. So we can be fairly certain that this patient has a normal looking visual field test, and although it's up to the clinician to confirm that, you could be pretty confident as a technician to reassure the patient that this field test was normal in their left eye. The numbers are in the 30s, which backs up your assessment, and also the MD is very low, and the machine thinks that the glaucoma hemifield tested within normal limits, and therefore the machine would also agree with your assessment that this is a normal visual field. By contrast, a patient with early glaucoma may have an extension of their blind spot that goes up or down in an arch shape, a so-called arcuate scotoma. And you can see that this arch shape goes down and round, but respects the horizontal midline, so that all the visual field defects are below the midline. The glaucoma hemifield test of the machine suggests that there is an abnormality consistent with glaucoma. The MD is equivocal, but certainly not normal at -3. And so that would support the clinician's assessment of this being possibly consistent with glaucoma, but not certain. And indeed, if we look at both eyes, the left eye has an arcuate scotoma coming down and round from the left blind spot, similar to the right eye, which we've just seen, which has an arcuate scotoma coming down and round from the blind spot. So a clinician would probably say that this patient has glaucoma, particularly if they have optic nerve and intraocular pressure changes consistent with this. By contrast, an advanced glaucoma shows that the blind spot is linked in with a large visual field defect that goes up and over this time rather than under, even extends below the horizontal midline, but the horizontal midline is largely respected, confirming that this is likely to be glaucoma, particularly since the machine agrees with us and the mean deviation is markedly abnormal at -18. If you have access to the patient's old visual field tests, you might see that the grayscale plot is getting worse and worse and worse. And if you link that with the reliability of each of those tests and can look at the MD, the mean deviation, you can at least flag up this worsening visual field defect to the clinician who may wish to prioritize the follow-up of that patient. Contrast this to this visual field plot, where there is a visual field defect without a doubt. Here's the left blind spot, which is normal, but there is a large visual field defect above it, and to a certain extent below it, which this time respects the vertical midline. You see to the right of the midline is a normal visual field. That's the left eye. The right eye actually has something very similar, where this is the normal blind spot, but here's a large visual field defect which respects the vertical midline. To the right of it, everything's fine. To the left of it, certainly on the top quarter, there's a markedly abnormal visual field, and to a certain extent below the midline as well, there's an abnormality. If a clinician sees this, he will immediately get a brain scan, and thanks to the visual field test, this patient can have their right-sided brain tumour diagnosed quickly and treated as such. So you can see that your role as a visual field technician is absolutely crucial here. Here's another visual field defect, this time affecting the vertical midline of the left eye, but in the right eye it's a mirror image. This is a so-called bitemporal hemianopia of the pituitary tumour that was successfully treated and the visual field defect went away. You may often be asked to perform the Estermann visual field test, whereby the patient has both eyes open. And here, the Driving and Vehicle Licensing Authority, the DVLA, are keen to know about the central 20 degrees in all directions, because if a patient misses more than 3 points in the central 20 degrees, they cannot drive, particularly if it's associated with an advanced or large visual field defect outside of that central 20 degrees. So although it is up to the clinician and to the DVLA to tell a patient not to drive, a patient may well be very eager to know what your test results are like, and you can at least direct them to the DVLA's website to assist them in knowing whether they can or can't drive in the future. So in summary, we can now check the patient's details, look at the grayscale plot, check the reliability indices in the top left of the printout, and read the machine results, and tally these all together to determine whether this is a normal or abnormal visual field result. We can advise the patient as to whether it's a normal looking result or not, with the proviso that the clinician needs to be the final arbiter of that. As field technicians, you might well be able to spot the abnormalities of a glaucoma or brain tumour or a worsening visual field plot and highlight this to a clinician in advance of the patient's planned outpatient appointment. You can also help the patient to decide whether they are legal or illegal to drive, once again with the assistance of the clinician and, in this case, the DVLA. Thank you very much for your interest.